Hello, my name is Peyton Brown, and this is my presentation about nuclear medicine imaging. Other modalities can scan certain parts of the body, but no other scan has the wide range as nuclear imaging medicine. From being able to find cancer throughout the whole body to finding Alzheimer's with a 3D picture of the brain, the possibilities of nuclear imaging are many. Nuclear imaging works by first injecting, breathing, or swallowing a radioactive tracer in any way. There will be an absorption period that can range from a few minutes to a few days based on the tracer injected, so it can reach the targeted cells. The patient is then scanned by a gamma camera, PET machine, or other imaging device. Finally, the image is processed and formed into a 3D or 2D model of the area scanned. There are several types of nuclear imaging, such as a PET scan, which can show levels of chemical activity, which is useful for finding diseases, show level of blood flow in the heart, and the metabolism of the cells, which is used for showing how well cancer treatment is going along, and can show brain disorders such as Parkinson's. This test is more accurate than the SPECT scan, but is also more expensive. Next, the gallium scan is used to find inflammation throughout the body. The gallium is injected and allowed to spread throughout the body for 2 or 3 days, where it conglomerates in places with high blood white cell concentration, which shows inflammation in the body. MIBG scans are primarily used to find neuroblastoma tumors. However, it is commonly paired with an iodine tracer, so it can be used to find metastatic diseases along with bone and soft tissue tumors in the body. The scan can be given 1 to 3 days after the tracer is administered. The iodine and MIBG substance collect in spots of tumors and disease to form black spots on the image, like shown in the example. Bone scans are used to show the metabolism of the bones because the tracer goes to places with high blood flow within the bone. This type of scan is also used to see if cancer has metastasized into the bones from another part of the body. This type of scan only lasts for a few hours in the same day. The SPECT scan is very similar to the PET scan, as they both show areas of activity in the brain, blood flow in the heart, and metabolism in the bones and cells. However, the SPECT scan is less expensive, but at the cost of having more artifacts in the image afterward. The tracers that are commonly used are all quite unique, as in they all have a specific purpose, such as FDG is a radioactive fluorine molecule attached to a glucose molecule. This allows it to be taken up by cancer and other places with high cell metabolism. As these cells need more glucose to grow, the fluorine gets deposited in the area of the cancer. This tracer is best used for non-small cell lung carcinoma. The 18F fluoride is used to find areas of high blood flow in the bones, as it is used in bone scans mentioned in the previous slide. Deposits in areas of cancer, in joints with arthritis, and in fractures. Thallium is specifically used in something called myocardial perfusion imaging, and where they use a stress test where the patient does exercise and then gets scanned, and then a resting scan in order to show the blood flow efficiency of the heart. Gallium is used to show places of high cell division across the entire body. However, it usually ends up in cancer and the bones along with certain organs. It takes 2 to 3 days to fully incorporate into the tissues. Technetium-99m is used in something called a sestamibi scan, which shows the amount of blood being pumped through the heart, otherwise known as a myocardial perfusion imaging. Finally, the FMISO is used in finding tissues and tumors that are hypoxic in nature. As in non-hypoxic tissues, the FMISO compound can be converted into oxygen, while in hypoxic tissues it cannot, and the FMISO will build up in these tissues and tumors, showing where it is and if it is a tumor. Cancer is detected effectively in most of the nuclear imaging scans, as they can use FDG fluorine-tagged glucose for it to show up. The most effective of the scans is the PET scan, as it can get a 2D image with bright colored spots indicating cancer. The cancer has a massively increased cellular metabolism and therefore will absorb more of the FDG in turn, showing the bright spots on the scan, like in the image here. Advantages of nuclear imaging are great, with it showing the chemical activity of cells, and with so many different tracers offering to tag different things, it can be extremely sensitive and streamlined to find certain things in the body with relative ease. There is also the case of these tracers being used for actual treatment, such as the case for iodine 131 being used to treat hyperthyroidism. and thyroid cancer by destroying some of the overactive thyroid cells. The final two advantages are the fact they can give a 3D anatomical image of the organ or body, allowing for a great view of detail to be exposed about the health of a person's body, along with the fact that nuclear imaging can be used to catch on to certain diseases extremely early, and in some cases, even before they show symptoms. This allows the doctors to show a plan of action in case of a major disease, allowing for an even higher chance of recovery. However, there are some disadvantages of nuclear medicine, with a glaringly obvious one that there is some radiation exposure, but this is a minuscule amount enough that the benefits outweigh the slight risk. The nuclear imaging process, however, is also not healthy for pregnant women and just pregnant mothers, as the radiation can spread to the baby and sometimes spread to the breast milk for a couple of days after the imaging. There's also the cost of making the tracers, which is quite expensive as these tracers are man-made, and making any sort of radioactive material is quite expensive, especially if it is going to be medical grade material. The final risk is that there is a very small chance of a person being allergic to the tracer. Nuclear imaging really shines, however, when it's connecting with other modalities, such as a CT scan or an X-ray. These allow anatomically correct 3D models that show selective organs and blood vessels with how efficient blood flow and how they are functioning. The photo on the slide is a PET CT scan, and you can see the extreme level of detail available in one of these scans, with the possibilities of being able to see everything in the body. These hybrid scans are extremely useful in finding cancer, as you can see a 3D model of where it is in the body. Some common applications of nuclear imaging are again the myocardial perfusion scan, which allows for doctors to see the dead tissue and blood flow efficiency of the heart in the body. Lung cancer detection with the gallium scan showing cancer in the lungs, and the FDG showing non-small lung carcinoma, along with both tests allowing for stage classification of the cancer. The bone scan can be used to find and evaluate fractures of the bones along with the metastatic cancers and their increased cell growth in those areas, along with showing thyroid function using radio-labeled iodine to show how efficient hormones are being produced, along with showing if there's any cancer in that area. The future of nuclear imaging and medicine is bright, with this being used in order to personalize healthcare, allowing for even more efficient healthcare with less wasted resource trying to find out what is wrong with the patient. Instead, the doctor can scan them and have an idea of what is happening, along with the molecular characteristics of their body and whatever they wanted to scan. This allows them to prescribe an even more educated course of action in order to treat the patient more effectively. An example of this includes using radio-labeled estrogen in order to see if the breast tumor has a HER2 gene active, allowing for certain medicines to be more effective against it. Another bright future of nuclear imaging is the creation of even more hybrid scans, such as the PET ultrasound scan and the more advanced PET MR scans, which allow for even clearer images of the anatomy and functions of the body. The final slide is more futures of nuclear imaging, with tracer agents with nanoparticles allowing for great advancements in the field of nuclear medicine, with a tracer being able to attach to atherosclerosis plaque in the carotid artery, for example, and the deposit of the activated nanoparticles onto it in order to erode the plaque. The biomarkers are just certain radio-labeled processes that show how effective a certain therapy is doing, such as a tumor shrinking in response to chemotherapy to show how effective the chemotherapy is. This is the end of my presentation.